I am Reverend Father Cyril Titanji. I am a priest of the Diocese of Kumba, the parish priest of St. Paul Parish, KwaKwa, Diocese of Kumba, Republic of Cameroon. We are here at the parish presbytery, the parish compound, and we are happy to have you missionaries come to live our experience, our challenges. My personal challenges as a priest working in KwaKwa Parish, they are not much because I am aware my life is a life of service, and wherever there are people, my Christians are like this, I am happy to be with them. But some of the challenges that are predominant in this area will be accessibility. At times, as much as I want to be with them, the roads are so difficult. There are areas where the whole rainy season will pass and I will be unable to make it and to be in those areas. And I think it's a difficulty that will come also even to the health care that we don't have here. A sick person going to the hospital is too difficult because of the nature of the road. And so if the hospital can come close to us, it's going to help the people immensely. The area is too broad with poor road network. Majority of the people working in this community are farmers, and they are very hardworking people, and they can't work well and serve God well if they are not healthy enough. But we don't have any health district in this community. If any of them are sick or their children are sick, they have to go right to Kumba and get themselves attended to. The nature of the roads make it very, very difficult for them to successfully receive all these treatments in time. And so a health service here will be of great help because we have this difficulty of accessibility. Our roads are not accessible enough, and if someone is sick here, he has to travel with lots of difficulty to get health services. The population here is so much that we need these health services to come and be in a community like this. Just KwaKwa itself is a little bit accessible, but there are many other villages within our parish and neighboring parishes that will be of beneficiaries to this particular health center if it is ever created here. Close to 50 villages and above will benefit. KwaKwa Parish as a whole has 18 mission stations, but it has over 50 villages. These villages have population of people that will also bring themselves to receive treatment from a Catholic service like this. And so we actually think that the population that will benefit from a Catholic service, it will not be only Catholic Christians, it will be for every human person living in this area, this rural area where we find ourselves. The situation of infant and maternal health care in my community is very, very pathetic, because majority of the women, they give birth to their children in the bush. In the bush because of the crisis. Prior to the crisis, there were health services. Few hundreds of women have given birth in the bush with the help of local midwives. And imagine a situation where these women have to give birth and they need an operation, and without any anesthesia, they have to go through a very painful experience to bring forth children into the world. And majority of them are suffer like this. And those local midwives are not many of them. They are few. Imagine if this midwife cannot be everywhere at the same time. Whereas if a woman is pregnant and she comes over to the health center, she can easily be treated and attended to, and the guarantee for her giving birth safely will be there. And it's difficult for that child to be born in the hospital, maybe because the parents were not able, because of the distance and the nature of the road and the difficulty of the terrain, to get to the hospital. We find children being born with complicated cases, maybe because the parents never went for antenatal treatment, and some of those children, they are blind and they have difficulties seeing because of situations like that. So at times people die in their houses here because they have no health services that will provide for them.